Thank you. Okay, a warm welcome to everyone joining the CSC webinar today on Democratising Healthcare in Pakistan using Telemedicine. The webinar will address the CSC theme, Strengthening Health Systems and Capacity. I'm very excited to introduce to you our speaker today, Commonwealth alumni Dr. Iffat Zafar Agar from Pakistan. Dr. Iffat Zafar is the co-founder and chief operations officer for Sehat Kahani, a telemedicine startup based in Pakistan. Dr. Iffat Zafar has been featured by Forbes for being the founding team of the 100 to Watch companies from Asia 2022. Dr. Iffat has been part of some prominent global accelerators and has won notable awards, which include Spring Accelerator and MIT Enterprise Forum Pakistan. Dr. Iffat Zafar is a 2017 Commonwealth Distance Learning Scholar from Pakistan. She completed her master's degree in global e-health at the University of Edinburgh. If you're interested in connecting with Dr. Iffat Zafar, please do so via LinkedIn. If you have any questions on this webinar topic or telemedicine, please do send these questions in the chat box. I'll make sure to address them during the Q&A session. Without any further ado, I'll now hand over to you, Dr. Iffat Zafar. A warm welcome, Dr. Iffat, and thank you very much for delivering this webinar for us.
Hello, good afternoon, and thank you so much for this exciting opportunity. Very excited to be sharing my journey, not only as a physician, but also as a Commonwealth scholar with all of you here. So as she very humbly mentioned, my name is Dr. Iffat Zafar Agha. I'm a medical doctor by profession based out of Pakistan. And I started an organization called Sehat Kahani. Sehat Kahani essentially means story of health in Urdu. And what it does is that enables or it solves two problems, which I'll talk to you about in a bit. But I think something that is really close to my heart and something that is really exciting is that I was able to achieve the Commonwealth scholarship, for which, with the support of which I was able to do my MSc in Global E-Health from University of Edinburgh. I think for someone like me, coming for a developing country like Pakistan, going to a university like Edinburgh, securing a scholarship and getting actually a postgrad degree from that kind of university is always a dream. And I think a dream which Commonwealth really kindly fulfilled for me, something that has added a lot of value in my work, since the master's focused on telemedicine, mHealth, and creation of access to healthcare using digital technology. And that's what all of my work is about. So very excited to be sharing that with all of you here. Just briefly outlining it, I've done an introduction to myself. I'll talk about some healthcare gaps in Pakistan and the core problems that we face here. I'll also introduce my organization, Sehat Kahani, to all of you. I'll talk about the work digital health did during the COVID crisis in Pakistan. I'll also talk about our world pertaining to maternal health, child health, mental health, some successes that we have celebrated across the years, and where are we headed? So I think, as Devina very kindly mentioned, one thing that I just love to share with everyone is that last year, Sehat Kahani was mentioned in the Forbes 100 to Watch organizations in Asia, something that me and my partner are really proud here to be sharing with all of you. So this is me, this is my co-founder. We both are medical doctors by profession. We both have collective 14-year plus experience of working in the digital space, digital healthcare space, pharmacy space, as well as the community healthcare space. And some credentials that we love to share with everyone. You all got to know that I am a Commonwealth scholar and I did my MSc in Global E-Health. I was also awarded the Heroine of Healthcare Award given at the World Health Summit last year. I'm a Global Good Fund Fellow, and I'm also an MIT Elevate Prize winner, all for the work that I've done for Sehat Kahani in enabling healthcare access and democratizing healthcare access in a developing country like Pakistan. So what is the challenge that we face? Pakistan is the 5th largest country in the entire world when it comes to the population. We have around 230 million people as a population base for the entire country, the 5th largest. But the irony is that a lot of them are not able to access quality healthcare. And there are multiple reasons for it, but some prominent reasons that we've seen over the years include the following. We have a good doctor base of around 245,000 licensed doctors. Ironically, because of social and cultural norms, 80% of the people who become doctors are females. There's actually a term for it, which is called the doctor bride phenomenon, where in Pakistan for the longest time, because of a patriarchal nature of the society, the professions which were considered most suitable for women included either becoming a teacher or becoming a doctor. And a lot of people believed that if their daughters or their sisters became doctors, they didn't encourage them to become a doctor just so that they would save lives or create healthcare access. But their notion in their mind would be that through those women, they would be able to add a lot of prestige to their family by adding a doctor suffix on their name. The girls would get better hands in marriage. Hence, the title Dr. Bride phenomena came forth. So ironically, while we have a good number of doctors available in the entire country, a large population of this is female doctors who do not practice. Out of this 80%, the female doctors who actually end up practicing is only 40%, leaving a good 60% of doctors who never work. Also, being a developing country, we lose a lot of doctors every year due to brain drain. It majorly includes male doctors, but since the last few years, also includes some female doctors as well, who leave Pakistan for better work opportunities. A good 15 to 25% of doctors leave Pakistan for better work opportunities. This leaves us with having 0.5 doctor for 1,000 patients. Now, what it does is that for a country with such a humongous population base, this results in more than 50% of the population never accessing a quality healthcare physician or a doctor in their entire lifetime. But I think while there are challenges, an opportunity that me and my co-founders saw in this gap was that while people don't have access to healthcare, almost the same number of people now have access to a smartphone, they have access to internet, and this number is on the rise every day. And that's what we felt could become a base for creating a platform which enables healthcare access across the board without having the dependency of a physical space where people need to go. So in a crux, what is Sehat Kahani? Sehat Kahani means story of health in Urdu. And it's a digital healthcare platform that connects patients in need of quality care to online doctors by affordable, convenient, easily accessible technology-based healthcare solutions. We started the organization in 2017, and we started it with the notion for creating healthcare access for the very marginalized or the low-income populations. And what we used to do was we would go into communities, we would identify qualified nurses or lady health workers, and we would upgrade their existing 2-roomed clinics into a telemedicine center. So it would be like any other regular clinic where you would walk in, a nurse intermediary would be present there, and she would connect you to a doctor online through their laptop. Once the consultation is done, the doctor would write their own history, they would write their prescription, and the nurse would print it and hand it over to the patient. So we started by creating these e-health clinics in remote, marginalized, low-income communities with the notion to be able to employ more and more female doctors and to be able to create healthcare access for that geography who had never seen a qualified doctor in their life. Being a for-profit social impact business, since our very first day, the entire business model was built around a sustainable model, where the idea was that people can access healthcare at a subsidized cost at these e-health clinics. But then in 12 to 18 months, we have to ensure each clinic becomes sustainable on its own unit structure. In 2019, by 2019, we realized that the two problems that we were trying to solve. The first problem was female doctors dropping out and not optimizing their medical practice. And the second problem of lack of healthcare access was not being entirely met if we remain just focused on the marginalized communities. And we realized that a lot of urban population needs healthcare access. Their pain points might be different. So for example, cost might not be a challenge for them, but then lack of time, lack of instant access to a doctor when they really need it might be missing. Also, we realized one clinic at the max can accommodate 2 to 3 doctors and not more than that. But on a mobile application, that limitation is removed. So in 2019, we felt we needed to create a mobile application allowing urban populations, people like you and me, to be able to access a doctor. And that's what we made. We made a mobile application which would allow anyone with a smartphone to be able to access a doctor from their phone. The application had two verticals. It has a consumer vertical. So even all of you who are listening to me right now can actually access a doctor by downloading the Sehat Kahani application from the Play Store. Our biggest USP has been that you can access a doctor in less than 60 seconds, something which no other player or no other competitor in my part of the world is giving as an opportunity. We also created a mobile application, which is our most winning feature. During COVID, we realized that a lot of organizations wanted to create healthcare access for their employees, but they didn't know how to. Through this corporate application, employees as well as their families get unlimited access to general physicians, around 40 plus specialties, as well as mental well-being experts. So they can access a physician no matter where they are based out of in the world, get instant consultation for which even they don't have to pay. Their employer pays on behalf of them. So if you can look at it, some visuals, this is how a clinic looks like. You walk into a clinic, there's a nurse intermediary who facilitates your consultation with an online doctor. The application is very straightforward. You have a mobile app and you can access doctors through that. I like to call it the Uber for Doctor model, where you have a list of all of the doctors who are online at that time, and you can access them whenever you need them. I think our technology has been very robust. It's a technology entirely built in-house within Pakistan. It's very simple to use. Within 3 clicks, you can access the doctor, as I already mentioned. For the consumer application, you can pay through your various Visa cards, MasterCards, debit cards, some mobile banking channels as well within Pakistan, as well as abroad. For a corporate application, as I mentioned, your employer pays on behalf of them. And the most winning feature, which you can see here, which the corporates just love, is the real-time dashboard, which is updated every day. This dashboard, as well as the application, is backed and saved through the cloud on Azure, which is a Microsoft product. The dashboard is built on Power BI, again, another Microsoft product. And through this dashboard, you can have a real-time analysis of the geography, the leading ailments for which people access consultations, the key gender breakdown, as well as the timings of the day in which most consultations took place, something which the corporates just love to know. We're the only company from Pakistan to have had ISO certification. We've also had a data protection security audit done for the application. It's 100% secure. Our network of healthcare professionals includes 7,500 healthcare professionals, which are present not only in Pakistan, but are spread all across the globe. A good 19 to 20% of these physicians are even based outside Pakistan. And some prominent countries include the US, UK, Saudi Arabia, UAE. I think, so we created the network of clinics, then we launched the mobile application. And then as soon as we launched the mobile application, instantly, it didn't seem like a success. But in March 2020, COVID hit Pakistan. And that's when it became a really successful venture for all of us. We started working with a lot of international partners, including UNDP, GSMA, British Asian Trust, World Health Organization, Grand Challenges Canada, all during COVID, to create more and more opportunities for people within the marginalized communities, low-income sector, mental health area, to be able to access healthcare in one form or the other. With UNDP, we worked on an exciting tele-ICU product, which allowed people or patients in remote areas the ability to access critical care experts, which were based majorly only in the leading tertiary care hospitals in the leading cities and were not going remote. We worked actively with the government. So we partnered with the federal government, where we made our consumer application free for around 6 months so that everyone could use it. We got around 100,000 plus consultations during those 6 months only on our consumer app. We also partnered with other government-based entities. Some of them some of the names that I can think of included Yarane Watan, Sehat Express. I think this is something that I really love to share here. During COVID, it wasn't just Pakistan which was shut down, but a lot of the places in the world saw that the regular clinical spaces or regular OPDs were not working and people were finding it difficult to access a doctor. So I think I'm really excited to share here that during COVID, people accessed a doctor online in countries such as Australia, such as India, such as Saudi Arabia, Nepal, Philippines, a large part of the US. So I think something that really excited me, a product, while it was not marketed outside Pakistan, in any part of the world, was still being used because healthcare is global. During, as COVID started to subsidize, and also somewhat during COVID, one thing that we all identified was that access to healthcare, especially for the vulnerable population, such as women and children, was highly affected. And we always knew that Pakistan is a country where access to such vulnerable populations has been a challenge in the past. They don't have access to digital technology. They're really ignored. Because of conservative societies, they're often not allowed to go to places. They're not allowed to go to a hospital without a chaperone most of the times. So we started to create opportunities for these women to enable access to healthcare within their communities only. Some organizations that we have prominently worked with include Spring. This was a project specifically focused on adolescent healthcare pertaining to girls, which included educating communities for delayed marriages or delayed birthing. And, if, for example, there is a young mother, how can she access healthcare in a better way? Other projects included Amplify. iPass is another organization that we actively work with. They actively work, again, with lady health workers who have a smartphone, who go door to door and allow women and children to be consulted with a doctor on the phone, something that we are really excited about. Then with World Health Organization and Grand Challenges Canada, we scaled up our network of e-health clinics in very remote communities, in places such as Balochistan, such as KP, communities which were heavily affected by not only humanitarian crisis, but by natural disasters, and also by severe conservative cultures which were not allowing women to access healthcare. But we were able to crack that. We also actively started to work with British Asian Trust, an entity which supports mental well-being. And through them, we have been enabling healthcare access pertaining to mental well-being in these marginalized communities. So where are we today? Today, I'm really excited to share here with all of you that we have a network of 49 e-health centers spread all across Pakistan in all the 4 provinces, also the state of Azad Jammu and Kashmir. For our consumer application, we have 1.4 million users. For a corporate application, we are working with around 650 plus corporations. And you'll see the corporations in a bit, but all high-end corporations whose employees now have access to Sehat Kahani services. Collectively, through all of these mediums, we've done around 1.9 million consultations. On this slide, I think something that I just love to share here, and something that really humbles me out, is that Sehat Kahani was an organization that, without any marketing budget, was covered by organizations such as The Telegraph. During COVID, the work that we did was mentioned by The Economist, and we were featured by, Thomson Reuters Foundation. We were featured by CNN. So some really exciting credentials over the years that have celebrated our success with Sehat Kahani. So I talked about our corporate portfolio, and these are all the leading corporations who access Sehat Kahani services. So those people who may be familiar with Pakistan can see that this includes the leading banking sector, leading pharmaceuticals, FMCGs, all of them. So another exciting partnership that we did last year was that we knew that we are creating e-health centers in communities. We also have a mobile application, so people can access a doctor through their app. There's still going to be a subset of population who does not reside in communities who have Sehat Kahani clinics, or they may not have a smartphone. They may only have a feature phone. That's when we created a partnership with a product, Lifebuoy, with Unilever. allowing people to access a doctor 24/7 through a medical helpline, completely free of cost for them, sponsored by Lifebuoy. Something that has been really close to our hearts. This project has grown and created immense impact in very marginalized, low-income communities. People who did not have access to a doctor now had one through this. For the very first time, we also created the very first public-private partnership through which basic healthcare units were outsourced and converted into telemedicine centers. For the very first time, the state of Azad Jammu Kashmir has allowed us to upgrade and add telemedicine to 13 basic healthcare units across Kashmir. In the next few years, in the next 5 years, we want to scale this to over 150 communities in Pakistan. And the scale would not be limited to just a telemedicine facility. The idea is that it becomes a centralized place, whether you want to access a general physician, a specialist, a mental well-being access, whether you want to access pharmacy, you want to access diagnostics, this e-health clinic should become a centralized place where you can access all the various healthcare domains that are needed, especially for women and children. For our mobile application, we're adding an online pharmacy and an online claims management feature. And the idea is that it remains a one-window channel solution. So it's going to be just one window. If you want access to a doctor, you will connect to an online doctor. The online doctor or the Sehat Kahani doctor becomes that one channel who decides whether you want to be connected to, whether you need to get a prescription, which will be delivered at your home, whether you need to be connected to a specialist, or whether you are sick enough that you need hospital admission, for which, again, the same doctor would be responsible for managing the entire claims journey. We also believe that now healthcare is going to be very exciting with all the chat GPTs and the AIs coming forth. Not only will it help us enhance the quality of our medical expertise, the diagnostics, but over the years, a lot of exciting medical products can also be integrated with this, really creating a more inclination towards preventive healthcare versus curative healthcare. In the next 5 years, we are looking to also take this organization and scale it into countries with similar challenges, whether they're challenges pertaining to healthcare or whether they're challenges pertaining to physicians who are not able to optimize their medical practice. So in this year, we're looking to scale into UAE, we're looking to scale into Saudi Arabia. In the future, we're also looking to scale into many African countries, Latin America. We're also looking to scale into countries such as Afghanistan, Nepal, Bangladesh. And in the next few years, collectively by scaling within Pakistan, as well as scaling in all of these different geographies, we want to be able to reach out to at least 60 million lives in total. For me, Sehat Kahani is something that I started with a little struggle that I myself had in my life. I come from a broken family. I was 12 years old when my parents got divorced. My mother suffered from a benzodiazepine addiction her entire life, a struggle that we were unable to match. And for me, access to healthcare is very personal. For me, access to healthcare should not be a choice. It should be something that is given to everybody. For me, healthcare access is going to be the future, changing how societies grow and evolve in a developing country like Pakistan. Because unfortunately, a lot of people end up losing all their finances, their homes, just because they have to spend on healthcare, which should not be how it is. I love a quote by Steve Jobs, and he says that the people who are crazy enough to think they can change the world are the ones who actually do it. And I truly believe in this. If you aim for the sky, that is the limit. You can dream as big as you want, and you can actually achieve it if you believe in your dreams. Thank you so much. And I'm here for any questions that anyone may have.
Many thanks, Dr. Iffat, for sharing your work and experiences. It's clear that Sehat Kahani is creating great impact, particularly for marginalized communities. We will now open the webinar to questions as part of the Q&A session. Please submit any questions you have in the chat box. Okay, we've got some questions in the chat box now, so I'll pose them to you, Dr. Iffat. Okay, so the first one we've got is, what is the structure for follow-up healthcare? For example, where sensitive medication has to be administered, or follow-up sessions are needed, or referral to a particular specialist that might not be available on the app/network. Does the product provide these directly or indirectly in any way?
Yeah, thank you so much for a very important question. So the Sehat Kahani application, whether it's being used on a smartphone or the software is being used in the e-health clinics, they all are primary healthcare solution with access to general physicians and specialities. Around 40 specialities are available on the application. But we tell the patient straight on in the beginning only that this is a primary healthcare solution. If you still don't feel better, go see a physical doctor. For patients where we see that this is a critical patient, a referral letter is given to them. If there is a specialty which is available within the application, the patient is then and there referred within the application. If we feel that is not available, a patient is provided with an entire referral letter, and they are referred to the nearby tertiary care facility. The same happens if a patient is quite critical and cannot be treated on telemedicine, that we refer them to the most nearby tertiary facility. We have a 24/7 call center, and the call center's role is to follow up with patients and do feedback calls with patients. So this call center ensures that if a patient was referred to a certain facility, it follows up to check whether that patient went for the follow-up or not.
Great, thank you, Dr. Iffat. That's very helpful. Okay, we have another question here. Okay, so the next one is, someone has a question about access to services, especially for the poor populations. Do they pay for the health services? That is the cost/affordability of the services. Okay, and then we've got another follow-up question. So I don't know if you wanted to just answer that one.
Okay, so let me answer that. The last one you were saying, what were the social aspects?
Yeah, do they pay for the health services?
Sure. So as I mentioned in the presentation also, one aspect of our work includes creating e-health clinics. And these clinics are focused in marginalized communities. And the reason we felt we needed a physical space is because we are so remote. A lot of the times people are not literate enough. And also women don't have access to a smartphone. These communities are so conservative that usually one family has one smartphone, which is usually owned by the men in the family. So having a physical space creates that safe space where women and children can walk up and get access and get consultation with the doctor who's online, who may be sitting in a leading city, but they're getting the best quality healthcare access while residing in the community. For the clinics, the services are very affordable. So for example, we charge 100 rupees, which is around $0.3 if you look at it. So they're very reasonable and they're comparable to any other quack actually who's working in that community. So people ultimately understand that, okay, we have to pay almost the same amount, but here we are 100% sure that we are going to a qualified doctor. The second thing that we also do, and we've started to do with Unilever, is that we have created a helpline. That's a service which is absolutely free. So anyone who has a feature phone can actually access a doctor. Obviously, a helpline has its limitations. For example, the prescription will be very limited. It will be focused on OTC products only. It may only focus on referrals, but this gives an opportunity to a large population to access some form of healthcare.
Great, thank you. Dr. Iffat, it seems like we've lost your slides, unfortunately. Please, could you just reshare that with us?
Sure.
Thank you. Thank you for that response. And we've got some follow-up questions to that as well.
Sure.
So follow-up question number one is this also the same as the corporates? So the services that are being offered, is that the same for the corporates?
Yeah, so the medical specialities are same all across the board. So the doctors, the general physicians that the clinics access as well as the corporates access are usually same. Even in the corporates, we try to create services which are same across the board, whether it's the CEO or even the contractual or the janitorial staff.
Okay, thank you. And then last follow-up question is, how is the situation with internet access? What impact does that have?
So interestingly, internet access is something which I think the telcos have done a great job in Pakistan. So almost every community now has a smartphone, telecom access. Most of the communities have internet. The exciting thing is that since the last 1 year, we're also working very actively with PTA, the Pakistan Telecom Association, and ITU. So out of all of these clinics, I remember there were only 2 communities where we felt internet was a problem, and we reached out to PTA and they solved our problem in around 3 days. So communities have good internet access.
Thank you, very impressive. Okay, another question we've got is, how much have older people engaged with the services via the app?
So our majority population who accesses the service falls between 20 to 45 years of age. Yeah, that's true. But we have around 12 to 13% of population from the older age group accessing the service. Usually they are people who are more educated, who can operate the technology, or those families coming into the clinics where they just have to walk in and they're not dependent on technology.
I see. Thank you. Okay, another question we've got is, what were the social aspects of the community in terms of acceptance and participation?
So in the initial days, when we just started in 2017, because digital awareness or digital acceptability for any product was not so prominent in Pakistan. So we had some challenges. And people, particularly conservative communities, would have this notion that, okay, why is there a camera? Are they recording, my wife or my daughter or something of that sort? So we did receive some backlash then. And then we created a campaign around that. What we used to do was we would hire community mobilizers who would go door to door educating women. We would do social groups where we would gather all of the women in one place, usually by some ambassador or some volunteer or some influencer from that community. There are a lot of women who are like in their older age group, who are very well respected in communities and people respect them. So we would engage with them. And through those support groups, we would give them demonstrations that, okay, this is how a laptop looks like and the doctor is going to be on the other part of the city. I think that really helped creating that one-on-one bond. And when people started receiving treatment and they started to feel better, I think a lot of the pushback ultimately died down. Interestingly, KP and Balochistan are two very conservative provinces, and we thought we are going to get a lot of pushback, but actually that didn't happen, because not only are those conservative communities, people generally, especially women, don't have healthcare access. So in those areas, healthcare was picked up very instantly.
Wow, it's really interesting to hear how Sehat Kahani overcame these challenges and really pushed through. Thank you for that. Please remember to submit any questions you have in the chat box once again. We've got some questions submitted to us ahead of time, so we'll go through those now. So the first one we've got is, the Gambia is a low-income country and in the sub-Saharan region. How can this great initiative be replicated in the sub-Saharan region, especially the Gambia, which is struggling with its health challenges?
I think that this sounds exciting, because I talked about how we are looking for regional expansion. Whenever we are scaling, even within Pakistan, how we work is that we identify donors or we identify international agencies who can support us in setting up such e-health clinics for a period of 12 months. And during those 12 months, we work on creating a sustainable business model. So the idea is, for example, if we were to go into this respective geography, we would like to identify some local stakeholders who can partner with us. We can create either a network of lady health workers who can enable healthcare access by creating a network of e-health clinics if the communities are very remote and they don't have access to smartphones. But if there is some smartphone penetration, the mobile application is also a product that can be launched. And then we can work on a project with some international agency, create it, build around a sustainable model whereby those units can become sustainable on its own. I would love, if anyone is interested for regional expansion, to have follow-on conversations.
That is really great to hear. Yeah, we'll put up your contact details later so anyone that's interested can get in touch.
Absolutely.
Okay, another question that we had ahead of time was, how can we in Pakistan change our healthcare policies through introduction of telemedicine technology for the benefit of the community at large?
So I think this is a gray area in Pakistan. Healthcare policy, or I would rather say digital healthcare policy, has been a gap. But during COVID, the government actively worked during that time. They created the first draft policy, which is out. I think, unfortunately, right now, we again are in a political scenario where, unfortunately, healthcare has taken a back seat. But I believe as the better governments come in the future, we are hoping that this draft policy can actually be finalized.
Great, thank you. Just a reminder, any questions you have, please post it in the chat and we will address it. Okay, another question we had was, how is this digital telemedicine reaching out to rural areas in Pakistan?
So as I stated, through our network of e-health clinics, as well as through our helpline, we are creating solutions which are targeted and focused to the marginalized and the rural communities. We are working actively with the government. And government, usually how healthcare in Pakistan is structured is that we have basic healthcare units in very remote areas. Then we have, tehsil units. Then we have tertiary healthcare units in bigger cities. These basic healthcare units are usually manned by a nurse and a doctor. Most of these doctors come in physically. But what we have introduced, or what we have ideated with the government, is that you don't need a physical doctor. Because in actuality, what happens is that either these clinics are so remote that the doctors don't stay there full time, or they keep on coming and going, which adds a lot of cost. So, and this is the project that we have initiated in 13 basic healthcare units in Kashmir, where we are enabling access to online doctors in these basic healthcare units. So that's something that, also enables access to very remote communities with the support of the government.
Thank you for answering that, Dr. Iffat. Okay, another question that we did have was, how can telemedicine be incorporated into mental health? And what are the challenges arising in South Asian culture in implementing this?
I think mental health is very important, especially I think post-COVID, people have really started to value the importance of mental health, not just in countries like Pakistan, but also worldwide. And I think a challenge that people often have with mental health is that there's a lot of stigma, and people don't want to be seen in the waiting areas of a mental well-being expert. I think there's always this notion that people want to access a mental well-being expert, but they don't want to be associated with it also. So digital consultation gives you that opportunity that you can do a consultation absolutely, anonymously. You can keep your video shut. You can just do an audio call just so that you are able to gain that comfort. Also, you don't have to go and visit a mental well-being facility. You can just do it, for example, while being in your conference room in the office, or your room at your home. So that brings in a lot of privacy. I think that helps. How we have started to work in mental health is that we work in 3 areas pertaining to mental health. So we work on creating awareness so that we can break the stigma. We create access using digital health, and we create referrals for critical mental well-being patients who can't be treated on digital health. And we do it in the communities with the support of partners such as British Asian Trust. We started a mental well-being project in universities with UNDP. And for our application, we are allowing people to access a doctor by paying per consultation. So I think mental well-being is an area which again needs a lot of support. It needs to be implemented in other parts of the world, and that's something that we are aiming for.
Wow, thank you. It's very interesting to hear Sehat Kahani's work in relation to mental health. Thank you. Okay, please submit any questions you've got. We still have some more questions for you, Dr. Iffat. Okay, the next one we have is, what is the financing structure for telemedicine currently, and how sustainable is it for the future of telemedicine?
So I'll talk about our financial structure. What we do is that we are a for-profit entity. We charge services. So in the clinics, we charge a certain fee. It is subsidized, but it's substantial enough for us to allow us to break even in 12 months at the clinical unit structure. So for example, whenever we are seeking funding from some external body, the funding is only to set up the clinic and to run it for 12 months. After 12 months, we have to ensure we are creating enough patient traction into the clinic and enough revenue per patient that the clinic can look after its own expenses, whether it's the online doctor, whether it's the nurse, whether it's, for example, the internet bills, the utilities, all of that. So while it doesn't cover, of course, for the company-wise expenses, it does break even at the clinical level. For our mobile application, for the consumer app, again, doctors can keep their fee as per their credentials. And there's a 60% of that charge which goes to the doctor, but the 40% comes to Sehat Kahani. For a corporate application, it's a very interesting model. We charge two kind of stakeholders. Either a corporate pays for the services that their employees are charging, and it's the annual retainer. So based on the number of employees and the services they're taking, they pay an annual retainer. It is irrespective of the usage. And the second stakeholder is the insurance providers. Pakistan has around 8 leading insurance providers, and we're currently working with around 5 of them. So they pay on behalf of their insured beneficiaries who now also have access to telemedicine. So this is how it works. Globally, a lot of insurance players are integrating or collaborating with telemedicine companies. A lot of them have built costing around that. So B2B plays a very important role in financial aspects of telemedicine. But then consumer application has its own benefits. People can go on the Play Store, download it, pay through their debit cards, credit cards. Unfortunately, in Pakistan, digital payment mechanisms have been quite slow. So for example, we still don't have PayPal. There are a lot of payment gaps that we still have. That's why our consumer application has taken a bit longer.
Great. Thank you for expanding on that, Dr. Iffat. Okay. We don't have any questions in the chat, but we do have some submitted ahead of time. So you've expanded on this already. We had, what is the business model? Is it a startup, NGO, non-profit? And how did you raise funding for Sehat Kahani? And what are the challenges in getting the finance to initiate a social enterprise?
So we are registered as a for-profit organization. We believe that we are an impact business, because in Pakistan, you can either register as a for-profit or as a not-for-profit. And our focus always has been in creating a sustainable business where we are creating impact while also creating a sustainable model. So we believe that we are an impact based organization. So we're not an NGO, just to clarify that. But how we raised funding? So we raise funding through 2 means. We either raise grants or we raise equity. So collectively, till date, we have raised around $3.2 million US. Around 1.7 of this has been through equity. So we raised a seed round of equity in 2018. Then we did our pre-series A round of $1.2 million US in 2021. And now we are headed towards a Series A round of around $3 million, which we hope to close in the next few months. For the grants, we worked with donors such as USAID, UK, WHO, Grand Challenges Canada, to name a few.
Wow, thank you. That is really great to hear. We have a follow-up question from that. So how did you manage to engage the target audience or customers that you have?
For the application, for the different channels, the patient base, basically.
Okay.
The patient base, you mean, right? I think so.
Yeah.
Yeah. So I think for the clinics, since we create those e-health clinics in communities, they are people from that community who walk into the clinic. For the applications, for the corporate applications, the patients are usually employees and their families from the corporates. So we have a key account management team. Their job is to make sure that more and more employees have downloaded Sehat Kahani application. They're using it. So we do a lot of promotional road shows within organizations with their employees. with the team members, with the support of HR members. For the consumer application, what we do is that we focus a lot on social media, advertisements, promotions, all of that.
That's great. Thank you, Dr. Iffat. Okay, if anyone else has any last questions, please submit them in the chat and we will address them. Okay. Okay, we haven't had any questions come through. So thank you very much, Dr. Iffat. And with that last question you've just answered, we've reached the end of the webinar. Thank you all for submitting questions, and apologies to those whose questions couldn't be answered. If you would like to get in touch with Dr. Iffat, she is available via email or LinkedIn, as you can see on the screen. Throughout this webinar, Dr. Iffat has helped in addressing the CSC development theme of strengthening health systems and capacity. Dr. Iffat, would you like to say a few words before we close the webinar to all of our attendees?
I think all of the work that I did, a lot of it has to do with me getting the opportunity to be able to secure scholarship and to be able to study in a field which was so relevant to the work that I did. So I got my scholarship and I did my master's in global e-health. And a lot of the learnings that came through in creating digital healthcare, enabling access and scaling it, and how do you design a product? How does a product look like for a marginalized community versus a product which works maybe for an urban setting? A lot of that came through my learning. And very honestly, for someone like me who is really ambitious, who's really aspirational, but they may not have the financial means to be able to go to Edinburgh and get the degree, I think the scholarship has really fulfilled the dream of being able to have studied from one of the best universities in the world. So I think that's something that I owe to the scholarship. And I think that's something that on which my profession is based to a large extent, as you all can see, that's all about digital health. So I think, the degree, the scholarship have played a really vital role in where I am today and with all the growth of the organization. So I think for all of you who have received scholarships, and for those who may know someone who wants to apply for a scholarship, I think that's a great opportunity for them to get exposure to some of the best teachers, best universities in the world. Also, I think on a personal note, I really love to tell everyone that, keep dreaming, keep aspiring, and the sky is the limit. And if you have some dreams and ambitions, you can actually attain them. So always believe in yourself, and the sky is the limit.